Okay, so talking about symptoms of the severe disease, we spoke about cough, we spoke about chest pain. All right. So symptoms are basically what the patient will tell you that okay, this is wrong with me. All right. So now, if a patient is having difficulty in breathing, trust me, they would say it out because breathing is the first reason why you are alive. Okay. So this dyspnea is actually difficulty in breathing. Okay. On a normal level, you are just having difficulty in breathing. Why orthopnea is actually difficulty in breathing when you are sitting or lying down flat. Okay, so trust me, anybody having difficulty in breathing will speak out. Okay, so that's why we say it is a symptom because it is actually what the patient will tell you. All right, so now let's discuss dyspnea and orthopnea as symptoms of cardiovascular diseases. So first of all, on our screen here is the dyspnea. Dyspnea can be spelled with an O. I don't know. Right, all my professors in school spell theirs with an O, but coming online, I'm saying that, but it's still the same thing, all right? So it's actually feeling of air hunger. You're not having sufficient air, all right. So you're actually working harder to breathe. Something like I'm breathing on a normal. I'll now be struggling to breathe. That's dyspnea, all right. So common causes of dyspnea can be heart conditions like heart failure, inflammation, then also lung condition like anemia, asthma, lung conditions like asthma, sorry. Then anemia is basically like the red blood cell count in the body is reduced. I know the red blood cells carry the oxygen. So you are breathing, but the oxygen is not being carried in sufficient, right? You understand? Then also when you have anxiety. But you guys know what brought us here. What brought us here is actually the cardiovascular system, all right? So be focusing on the heart condition. So our focus is to discuss dyspnea and orthopnea as symptoms of cardiovascular system disease. And dyspnea is actually shortness of breath. Shortness of breath can have causes that aren't due to underlying diseases. All right. So examples of causes of shortness of breath is actually exercise, altitude. If you wear tight clothing like me in school, when I put on tie, okay, I easily run short of breath though. And I'm actually telling people that I don't like tie, I don't like tie, I don't like tie. People are actually seeing me like a gangster, but I'm actually the cool guy. Alright? I don't like tie because it chokes me. Okay? Then if you have a prolonged period of bed rest or sedentary lifestyle, okay, can also cause dyspnea. Okay? So don't worry guys, don't worry. We are heading somewhere. How about autopnea? Autopnea is actually a sensation of breathlessness in recumbent position. Recumbent position is actually you sitting, relaxing, or you lying down. Okay? Now, you have to actually stand up or sit, okay, to relieve this. All right? So, if your autopnea is actually the one that is you lying flat, then you have to sit or stand. But if your autopnea is actually even the one that when you sit down you feel uncomfortable, then you need to stand. Okay. There's also paroxysmal what nocturnal dyspnea. Okay, paroxysmal nocturnal dyspnea is a sensation of shortness of breath that awakens the patient often after just 1 or 2 hours of sleep. Okay, it is usually relieved in upright position. Now, our professor in school actually explained this, and she said when you have difficulty in breathing when you sleep, is due to maybe your whole system is relaxed. So there's so much digestion going in. So it's thereby putting pressure to the heart. Do you understand? So it's resulting in paroxysmal nocturnal dyspnea. Right. So this is autopnea. This is you having trouble while laying down. Breathing is easier when you prop up with the pillow. All right, that's you taking up the bed or adding more pillows so that at least you can be in the 45 degrees. Okay, that's why I see many patients in the hospital, the cardiovascular section. You see, most of them, their beds are actually propped up, okay, to 45 degrees, okay, because they have problem breathing when they lie down. That is orthopnea, right? So let's just have a summary. Orthopnea is actually also known as breathlessness. It is difficulty in breathing. It can occur at rest, okay, or at exertion, right? So if you want to test for dyspnea, not really test, if you want to examine for dyspnea, sometimes you tell the patient to actually walk a short distance, okay? Some patients, maybe they just walk a little bit and they are breathless, right? Some patients, they have to walk maybe from the hospital ward to the hospital gate before they become breathless, all right? That's dyspnea. Then how about orthopnea? Orthopnea is breathlessness on lying flat, okay? So when you're lying down flat on your bed, you're having problems breathing. So sometimes you have to add 2-3 pillows so that at least you are lying in 45 degrees. Or if your bed is that type of a hospital bed type, you just prop it up, okay? So that it can be lying in 45 degrees. Then under orthopnea, there's paroxysmal nocturnal dyspnea. I told you that's you feel you have problems breathing when you sleep for maybe just 1 hour, 2 hours, right? So you have to wake up, stand up, right? So in paroxysmal nocturnal dyspnea, the patient wakes from sleep, all right? And our professor in school explained orthopnea as there's accumulation of fluid in the alveoli, okay? So when you lie down, it is becoming so relaxed that the fluid is now like covering the whole of the space in alveoli, so you are finding it hard to breathe, okay? Guys, that's it about dyspnea and orthopnea as symptoms of cardiovascular system disease, okay?